Diabetes has long affected members in my family, my friends, people within my professional circles. It's been a long-standing problem. When I first learned of the Georgia Diabetes Coalition, this was several years ago, I really felt that I wanted to be part of something that was solution-oriented, people that were passionate, knowledgeable, and extremely capable of changing the course of diabetes.
The GDC can advocate for diabetes prevention, treatment, and programming in Georgia in a number of ways. One of those is to ensure that all Georgians, and particularly those who are at risk for diabetes, are screened, and if they're identified, that they are referred and have access to programming and treatment. We want to make sure that all Georgians have fair reimbursement and that there is quality care available, standard of care throughout the state. Another thing that we really want to do is to affect environments and ensure that Georgians have access to safe places to be active and have access to health-promoting foods that do make a difference in terms of overall health. As models of care have evolved, we realize that diabetes education can't just be offered in traditional settings, such as hospitals and clinics. We realize that much of the education that we do in the future will also be offered in places where people work, where they live, where they congregate, where they worship. The GDC can play a key role linking people identified as having diabetes or prediabetes to the numerous services that will be either clinic-based or offered in community-based settings. Also, the GDC can play a key role linking clinicians and those people who work in community-based settings to make sure that they're understanding what each other has to offer and make sure that we are providing the right level of care and the right type of care and education to each individual with diabetes.
First is education, second is awareness, third is through professional development. Initially, we were a group of individuals that came together with an idea and concept based on a need to have more and do more around the state. In the last several years, because I have been hired as the executive director, I have been responsible for bringing the organization to its fruition, having a website, actually reaching out and touching organizations and individuals around the state and making a difference in their lives on a day-to-day basis.
Our membership will have doubled or tripled. I also expect that we will have several sub-coalitions set up and established around the state. Additionally, I would expect that GDC would be considered a potential funding resource for those coalitions as well as other organizations working to improve the lives of those with diabetes. And lastly, I would expect that the GDC would have an even stronger professional and public network around the state.
At the local level is to link people together with the resources and education they need locally. The role of the Georgia Diabetes Coalition at a statewide level is to look at best practices around the state and educate other individuals about what's happening, what their successes are, and things that are simply working at home. The role of the Georgia Diabetes Coalition at a national level is to look at our successes that we're having and share those as well as other best practices with other organizations and states around the country.
In our activities year after year, I would want to ask ourselves, are we consistent in growing our membership? Are we consistent in utilizing the resources that we have to distribute around the state? Are we consistent in our passion for wanting to help those that already have diabetes live a healthier life? And are we consistent in preventing diabetes for those that are at risk?
by looking at its strategic plan, which we worked hard on this year. We have very specific goals and measures and things that we want to accomplish. And so once we achieve these goals, we've gotten indication that we're on track, we can feel good about what we do. Some of these things are things like affecting diabetes and quality of care, making sure that all Georgians have access to standards of care. Also collaborating and working closely with the state diabetes prevention and control program and CDC, and helping to ensure that their objectives and programs have a broad reach throughout the state.
Well, the state of Georgia is unique in relation to the issue of diabetes, its incidence, its prevalence, and the level of complications that exist. The Georgia Diabetes Coalition is unique in that it was formed several years ago specifically to address those challenges.
On a professional level, the GDC has really helped me to expand contacts, connections, linkages, and develop some strong collaborations. As a clinician, I really didn't have an understanding of the broad health system and the public health system in the state. And I can say that through my involvement with GDC, I have a much broader perspective and understanding of diabetes statewide. Personally, it's been very satisfying to work with a group of highly motivated and talented professionals who are as committed as I am to changing the trajectory of diabetes in Georgia.
No matter what capacity within healthcare that you work in, diabetes is affecting everyone around our state. Our coalition is partnered with organizations, agencies, and individuals all around the state that have a common goal of changing the course of diabetes. So to join GDC is not only to join a strong, experienced leadership, but it's also to join a passionate membership where we are all collectively extremely focused on that goal and that mission. Additionally, the coalition is in a very strong partnership with our statewide diabetes prevention and control program. It's for all of these reasons that I feel anyone would benefit for joining the Georgia Diabetes Coalition.